Thank you very much indeed. My name is Theogene. I'm just going to talk about signs and symptoms of gastrointestinal systems. My email is harrisite59@gmail.com. I'm sorry for writing my Gmail, but we collect it. So here I have my GI system. GI system is made up of 6 organ functions, such as esophagus, used for what? Swallowing. Stomach and duodenum will be used for what? Digestive and absorption. We have liver, which are be used in anabolism and also catabolism. It contains enzymes, also will be using detoxification, and also will be used in bile secretion. We will have pancreas. Pancreas is one hormone secretions are used in hormone secretions such as insulin and glucagon, and enzyme secretions will be used in control sugar in our blood. We have colon, we will be used in our absorption and fecal formations, and colon where we have daily absorption of some nutrients that you have already ate, and also fecal formations. We have lactose. In lactose we have such fecal reservoir, where the reservoir of those feces. Common symptoms of GIC disorders: we have gastrointestinal symptoms, are common medical condition, and also subjective data of patient complaint. Here you have the following common symptom of GI system disorders. Here we can mention such as abdominal pain, when you feel some pain in abdomen, depending on the location, also will depend on the type. Here we can mention constipations. It is another symptoms. Another symptom you can find is diarrhea, where we have water stool more than 3 times a day. We have gas in the GI tract. Also it is another symptom, abdominal symptom, GI symptom. Venous distension, vomitus or regurgitations, where we have nausea and vomiting. We have dysphagia, where someone is having trouble in swallowing due to impaired reflex nerve of the esophagus and the oropharynx. Here I can mention odinophagias, where we have pain in swallowing. When you try to swallow something, then you get pain. So what we call odinophagias. Another symptoms, we have heartburn. Heartburn is another condition where we have burning sensation in front of chest due to some nutrition or due to some problem of GI of stomach. We can have hiccup or singultus. Singultus, involuntary spasmodic contraction of diaphragm, which will be followed by what? A sudden close of glottis. We can have hematemesis, blood vomiting due to bleeding of upper GIT. We have different GIT, we have upper and lower GIT. So if there is a bleeding in the upper GIT, you will have what you call hematemesis. We have melena. Melena is black blood stool due to bleeding of upper GIT. Yes, of course, it is black blood. Black blood is stool due to bleeding of upper GIT also. We have hematochezia, is a flesh blood stool due to bleeding of lower GIT. This is a blood stool. It's contra from melena. Melena is just from bleeding of upper GIT, but hematochezia. Mana reason awari. Hematochezia. Then we have sign of GI system disorders. Signs are objective data of physical findings. These findings are observed from physical examinations, where we can have inspection, we have palpation, percussions, and also scrutations. Most of common symptoms associated with GI system disorder, we have mental change. end stage of cirrhosis or severe hepatic disorder called encephalopathy due to false neurotransmitters. You have jaundice or ectelic yellow discoloration of the skin, sclera of the eye, mucous membrane due to excessive level of conjugated or unconjugated bilirubin in the blood. You have gynecomastia, occur only in the male due to increasing breast size, most common in cirrhosis to failure to inactivate circulating estrogen. Palmar tremor, local vasodilation is a long palmar side, most common in cirrhosis. It's palmar tremor. Meteorismus, accumulation of gas in the abdominal cavity due to electrolyte imbalance. If there is imbalance in electrolyte, we have this meteorismus, where we can have gas accumulation in the abdominal cavity. We have pain palpation. This is dependent on the topographic ascites, accumulation of fluid in the abdominal cavity due to decrease of osmotic pressure or increase of hydrostatic pressure. Hepatomegaly, this is an enlargement of hepatics, where you can feel it by palpation or percussion in the sonography. Splenomegaly is an enlargement of spleen due to infections. There is megal means big. If there is a spleen and a splenomegaly means the spleen has become big. An enlargement of the spleen due to infection can due to trauma, can due to hematologic disorder confirmed by palpation, even also by sonography. Flapping tremors of wrist joint after full due to encephalopathy hepatics. Pitting edema, this is accumulation of fluid in the subcutis, especially parental pedis due to hepatic renal blood vessel and the systemic inflammations. Thank you very much for following me. Just like, subscribe, share, comment on our videos. Wait for the next video sessions. Just follow me on Twitter, on Facebook, and also on Instagram. My name is Theogens. I'm using Halsite. Thank you very much.